there is a imminent possibility that the ground shift under us and we lose our hub status. As hard as it was, we should signal to the world we are doing our best to reopen.
Health Minister Ong Ye Kung.
Health Minister Ong Ye Kung.
Minister Ong Ye Kung found himself immediately in the midst of the fight against COVID.
Vaccines have already arrived. We started vaccination, mostly age 70 and above, I think. The younger group came later when we had more supplies. In most government restructuring effort, it always involved government corporatizing some of our functions to the private sector. In the case of CDA, we have a lab that's in Tan Tock Seng Hospital, and then we nationalize it into a government statutory board. One of the most painful things that happened during the pandemic was that the causeways were closed, the two links were closed, and you sever ties between Johor Bahru, Johor State, and Singapore. It was so painful for so many people, Malaysians and Singaporeans. They are big countries where they are in political gridlock, but they can survive it. We're a small country. If we are small and yet in political gridlock, then we're in big trouble. Oh, don't feel sorry for yourself. Every generation have their own opportunities and own challenges.
Ms. Song, I want to thank you for coming on.
Thank you.
Today, we're like about 5 years out from when the
5 years out. We declared DOSCON Green February 2023. So in fact, we just have our DOSCON Green Day. It's a day that MOH we observe. Actually, it's a day after Total Defence Day. Total Defence Day, I believe, it's all around the Valentine's Day period.
Yeah. 14.
So we observe DOSCON Green Day, 15th of February.
Why do you commemorate that day?
The pandemic, is largely a healthcare crisis. Yeah, a healthcare crisis that spilled over to all aspects of community and economy. So we, of course, were at the epicenter of where the pandemic is, together with the help of so many agencies, so many segments of Singaporeans. And by the time we reached DOSCON Green, it was a Liberation Day of some sort. Yeah. So we commemorate it within MOH.
It's a impressive feat because I think if you look back at Singapore's performance, you had the global average was about 1% mortality rate. We achieved 0.1% in a very dense, one of the densest populations.
Yeah, it's an urban environment, totally different. Say Canada, Australia, people live far apart. For us, very dense. And I'm very proud of all that we've done. Yeah, all that we've done, everybody chipping in.
And how a government response actually in a crisis actually is a best sign of how good that government is. So if I would like to take us back to when kind of the pandemic was first brewing 5 years ago, when you kind of heard that when you were back then the Minister of Education.
Yeah.
What were kind of the alarm bells that were ringing off in your head?
Right. But it's interesting you start with this line of questioning. I thought people forgot about COVID already. In MOH, we didn't. Yeah, we didn't. The experience lingers on because every time you go to work, every time I visit a hospital, every time I see a GP, I know we all fought side by side. That experience is etched deep in the memory and the muscle memory too of MOH. But interesting you raised this because I think it is an experience we should not forget where important lessons were learned and those lessons need to be institutionalized into better practices in future. You asked about when so I have the rather odd privilege of straddling 3 ministries throughout that 3 years of pandemic: education and transport and health. Education, I think what went through my mind first thing was, do we need to close schools? Many parents immediately, their first reaction is to close the schools. I want to keep my children safe at home. So at that time, I needed 2 pieces of inputs. One was from the principals and the school leaders. I asked how confident you are to keep the children safe. They were surprisingly very confident. They were saying all our processes are in place. Emergency processes are all in place. That was because of SARS, and we can activate them. Yeah, I think what they did not realize is that this is not SARS, right? But which means I need a second input, which that was probably the first time I contacted Kenneth Mark for a long time. I knew him from before in Khoo Teck Puat Hospital. He was a new Director General Health. At that time, we called it Director Medical Services. He got plunged straight into COVID. So I asked him, does this virus attack children more? or less. Bearing in mind the Spanish flu actually affected children more, right? So what is COVID-19? What creature is it? And his reply, and it's a considered reply from MOH, is that so far there's no evidence that it attacked children more. It seems to affect old people more. And that is the experience of the data coming out from China. So on that basis, I think we should not close schools. But at that time, there was a lot of pressure. I remember a petition, probably signed by tens of thousands of people. I don't know whether there were 100,000 petitioners, addressed to me, close schools. Minister Ong, what are you doing? Close schools. Yeah. So I really felt the pressure. People want me to close schools. And should I close schools? But based on the inputs, it doesn't seem to be so. So I decided to go out to the streets. At that time, there were no lockdowns yet. Whenever I meet parents with children, I'll ask, what do you think? Should I close schools? Almost unanimously, 9 out of 10, even more. Parents tell me, Mr. Ong, don't close school. If you close school, how am I going to go to work? I can't go to work. Yeah, keep the schools open, keep the children safe. That's when I decided, I think we keep the schools open. All over the world, schools were closed. And I can understand why governments close schools and why education ministers close school, because you can't afford to have any deaths amongst children infected in schools. Immediately, I think their heads will roll. So the safer thing to do is to close schools. Closing schools have very long-term detrimental effects on children, especially those from vulnerable backgrounds. But politicians are not around long enough to see those impacts. Today, people still talk about the impact of school closure on children. They are now growing up. Some are in their teenage years. Yeah, the impact is there. Some of them can never catch up. But, that political impact is many years down. And the minister at that time didn't have to bear those consequences. But we always take a long-term view. So we didn't close. We closed for 1 month during the circuit breaker. Yeah. But even during that 1 month, schools were open for the most vulnerable children. And what was very heartwarming, some of the long-term absentees that we have not seen in the school for a long time, they didn't turn up for schools. They turned up during that period. And they told the teachers, now there's nobody else around. I come back and I get the help I need. Yeah. So it becomes a refuge for them. And during that 1 month, even though we closed schools, we went on to online teaching, which today become part and parcel of the curriculum for secondary school students. They do it about once every 3 weeks. There'll be 1 day where you learn from home, self-learning, to get them, to teach them the skills for self-directed learning, which I think is needed. So that was the MOE story. Looking back, I'm quite glad we did not follow the rest of the world in closing schools.
I think we live in turbulent times. I think a lot of people kind of see that. But how do you then understand a government's ability to respond in those turbulent times? And that's where you kind of go back on their past track record, how they deal with pandemics, crisis, because that's when you really see their ability to move.
Good point. So in a crisis, you see your true character.
And it's interesting that Singapore, I think, was one of the only few countries that outside of that 1 month, you really kept schools open throughout the pandemic, which is actually the anomaly, not the norm.
We had a very good ideas from parents, They wrote to me to say, Minister Ong, this circuit breaker, why don't you not close school, but instead you shift the June holidays earlier by 1 month. Then you declare an earlier June holiday. Then you didn't have to close schools. So that was a great idea, brilliant. So we did that. It's actually feedback from the public.
Oh, that's interesting. I didn't know that. Unfortunately, I wasn't a student.
So we had circuit breaker for 2 months. 1 month is actually the June holidays. And then 1 more month is when we truly close schools and move to self-directed home-based learning.
And then we move on to your time in Ministry of Transport, where it's also you have to make another kind of difficult decision, because I think in the pandemic, the instinct is to close down and shut down. But Singapore being an important hub in the region, be it in air logistics or sea freight logistics, the cost of shutting down is huge. What was your rationale back then as to why you wanted to keep Singapore open?
We didn't keep Singapore open, right? Because The worst is a respiratory pandemic like this, because it means so long as we speak and interact and breathe and have social interactions, we pass the virus. So it hit at the fundamental of human society, that it says you can't interact like humans anymore. Society actually have to break down, have to close down. And so it didn't affect our PSA, because that is about containers coming in and out of Singapore. That proceeded. And in fact, PSA was doing even higher volumes during that period. There was a Suez Canal blockage, and then more containers came through Singapore. So PSA played a huge role, not just for Singapore, but regionally, globally, to make sure supply chain keep on going despite the pandemic. But I think aviation was the problem. Aviation is about passengers. It's about human movements, and that has no choice. Given the characteristics of the virus and the pandemic, Changi Airport has to close. And so it became a ghost town for many, many months. And I went to Ministry of Transport during that time, and that was my key mission. In my mind, that must be my key mission. How do we make sure at the end of the pandemic, we still have a Changi Airport, we still have an SIA? Because without that, I think Singapore's economy will take a very, very huge hit if people stop coming to Singapore. Or at the end of the pandemic, we described at that time, the pandemic is like a big mahjong tile reshuffle. And you reshuffle, you open your tiles. You used to have good cards, after reshuffle, you open your cards again. What kind of cards are you going to get? Are you going to get crap cards from then on? There is a imminent possibility that the ground shift under us and we lose our hub status. So I felt that as hard as it was, we should signal to the world we are doing our best to reopen. We tried all kinds of ideas. The one that really kind of got people noticed, got people attention, is our air travel bubble. So we look around for kindred spirit that might think the same way as us, and the closest was Hong Kong. Yeah. We approached many countries to consider. Most of them say, no, we want to be closed. We want to talk about this later. It was only Hong Kong and my counterpart who is quite open to the idea. And Hong Kong was at that time was also containing the virus quite well. So we thought if we are clean, you are clean, we can travel to each other. Yeah. So we announced the Hong Kong-Singapore travel bubble. Remember, I did a short clip in Cantonese asking Hong Kongers to come to Singapore. My Hong Kong counterpart did a video as well, urging Singaporeans to go there. And we were about to open when I think there was a cluster in Singapore, or was it a cluster in Hong Kong? I can't remember, that we have to call it off. And then we tried to restart, then a cluster appeared again in one of the territories. We have to call it off again. In the end, it didn't materialize. But I would think it's still a very worthwhile effort, because it got us on the map, on the aviation map, where people around the world notice that we are trying our best to reopen. Singapore wants to get back to business. I think that signal was important to send.
Those cases, especially with the Changi Airport, it seems to maybe a common observer is like, wow, that's actually a very over-sensationalized or overhyped view. Like, do you really think Changi Airport is going to go away? But maybe if you take a closer look, kind of the network effects or kind of the death spiral of a hub, if you look like throughout history, that hubs actually can die and wither away very quickly. And
be mindful. In maritime, we are a natural hub, because when you look at the flow coming through Straits of Malacca, is probably it is the shortest route to go to many other markets. But in aviation, we are not the most natural hub. Geographically, it can easily go elsewhere. At that time, it is really scary when you visit Changi Airport and it's empty. And it's empty. It's scary.
Why was this like the core mission of yours, in the sense of you really wanted to get it off going? Because if I'm looking at it as maybe a politician, I wouldn't take such a huge risk, because this is like to try this and try and fail 3 times. That's such a huge cost to my political capital, right? So why do you kind of still have that view that you should take this risk?
Because Changi is important to Singapore. Many livelihoods depend on it, not just the aviation sector, the whole economy. SIA is important, and I'm Transport Minister.
I think over time, governments or bureaucracies tend to be more risk averse. And I think one of the lessons that I've learned from the pandemic was that actually a lot of governments in the world became more risk averse, and they tried to do the more risk averse thing. And in a certain sense, it paid off in the short term, but not necessarily in the long term.
And we are lucky, I feel, to be in this environment where the people's expectations of government, I think it still holds true. The people's expectations of government is to do the right thing for my future. Take care of present, definitely, but also to safeguard my future and my children's future. And people expect that of the government. And if you are a minister or a civil servant or anyone in public service, you also have the ethos that I solve the current problem, but I also must have a strong eye, clear eye for the future. That is what's holding our system together. Always looking long term, always securing the future. So to me, it was quite natural, as I'm sure to all my colleagues that I work with in the ministries, which is when we face a problem, we want to look far and see how we secure our future. And that view, trying to get the air travel bubble up, even though we may not succeed, I think it's a view shared by all my colleagues in MOT at that time.
Your current portfolio, the Ministry of Health, where you've been there for close to 4 years already, it's one of the more complex ministries, I suppose.
It's the most complex. I've not gone to a ministry that complex. Economics don't work in MOH, Every other ministry, there's a set of economic principle you can apply. You subsidize, you tax, and how do you balance the two for which segment of your portfolio? In health, it's just so complicated. Every market failure you can think of, or you studied in school, in textbook, you can find it in MOH. Yeah. So I make a pitch here. If you're an economist, you want to do interesting work, you come to MOH.
Even when I was looking at some of your past speeches, it makes sense that the healthcare is you have all kinds of distortions in the market. And add on to the fact that Singapore is a small market, then that creates a whole nother distortion, way you even get the way you price drugs, the way you price treatments and things like that.
I was invited by Houston Kwa. He's president of ESS, Economic Society of Singapore, to address his members during one of their dinners, I think. Yeah. So I decided to put all the market distortions of healthcare into one speech and deliver it. My pitch was, no, please, if you're an economist, you want to do good work, be a health economist. I don't know whether I deter them or persuaded them.
The time in which you entered as the Minister of Health during the pandemic, you went on this massive kind of vaccination drive, and you wanted to push for Singapore to open up really fast. Can you take me through what you were thinking back then when you first kind of stepped in the role, given the fact that you were already on that steering committee during the pandemic?
If we want to open up Singapore, save our air hub, I think being an MOH is important. Yeah. So I went there at the same time. I was appointed as a chair, as one of the co-chair, one of the three co-chairs of the MTF, the Multi-Ministry Task Force. At that time, vaccines have already arrived. We started vaccination mostly to those aged 70 and above, I think. The younger group came later when we had more supplies. So we were already on the path of vaccination. So when I went to MOH, very shortly after that, we had our first corporate planning seminar where the key healthcare leaders and agency leaders all came together. At that time, there was social restrictions, so it was purely an online affair, but I could see their faces on screen, many faces. People at that time switch on their video. So at that time, I spoke about two things. It was close to the media, so it's not reported. First, a pathway to reopen Singapore. And second, healthier SG. Yeah. So even as we were tackling a pandemic, we were thinking about healthier SG. Because whatever we did during the pandemic, I think we can apply in peacetime, in a preventive care system. But the key priority agenda at that time is, what is the path going forward? Can we open up? So it was a bit of a testing the water. I want to put forward an agenda that we vaccinate, we open up Singapore. Even though it's online, the reaction from clinicians is that it's the right thing to do. It came across very strongly, even online. Yeah. So that really gave me a lot of respect to the clinicians, because I know this process is going to be really hard. And it will be hardest on our hospitals. Because when you open up, more people will get infected. Albeit, I hope they were all vaccinated at that time. Hospital workload will go up. A&E will be packed. Clinicians will be very busy. But notwithstanding that, they say, yes, do this to me. It's a correct thing to do. So going back to your point earlier, what is convenient and short term versus what is correct for Singapore for the long term, I think again the decision was made. And this time by the professionals. Yeah. So I got that encouragement very strongly. So presented that to the MTF, discussed with my co-chair, and we all decided this is the right thing to do. Of course, it wasn't straightforward. Immediately after that, we had the Jurong Port cluster, we have the karaoke bus cluster. Yeah. Delta strain came in and shot up. We pressed on. We couldn't open at the pace that we wanted because of Delta, the Delta wave, which only subsided probably later part of the year. Then it got replaced by Omicron. Came out from Africa, but the detection was in South Africa. We scrambled around looking for clues as to what this creature is like. Thankfully, it's milder. There was a turning point. Yeah. So when you have entered another wave where Omicron is milder, but still dangerous, and at the same time the population is getting more and more vaccinated, I think you have two factors in our favor. So that gave us the opportunity to open up. So what follows was a momentum that we opened up step by step until February 2023. Doors gone green.
And one of the key takeaways, because when I read the white paper, was that there was a need to, even then, to kind of better coordinate pandemic responses. So then there is now, if I'm not wrong, the Communicable Disease Agency that was set up. 2 years out of the pandemic, you set up a whole new agency that is focused on communicable disease. That's actually really fast. If you look at the grand scheme of things from a maybe bureaucratic perspective, that's a very fast implementation. And then the second thing that I was trying to grasp was, why was this setup necessary as compared to what you had maybe previously when you dealt with SARS? Why do you think there was a need for this CDA?
We shouldn't claim too much credit over CDA. Other countries have their CDCs. We never had one. Yeah. And after the pandemic, we felt should have one. Yeah. I would say there are two important things there. The expertise and the competencies are all there, but they reside in different agencies. Okay. Right? So we consolidate them into CDA. There are two important benefits. Number one is now we have a common interface with the rest of the world, because pandemic preparedness is international work. It's not domestic work. So now we have a CDA that is signing MOUs, building linkages with CDCs all around the world. We did one with China, for example. Yeah, we signed an MOU. We're going to exchange data. We know what's happening in China much better. Secondly is we had a lab in Tan Tock Seng Hospital. I think it's either part of MCID or it's outside of MCID, but it's more or less in Tan Tock Seng Hospital. In most government restructuring effort, it always involves government corporatizing some of our functions to the private sector. In the case of CDA, actually we have a lab that's in Tan Tock Seng Hospital, and then we nationalize it into a government statutory board. Yeah. Why do we do that? Because the science have changed. Imagine during SARS, that 2003, genome sequencing is not common, you know. So I don't think during that period SARS virus was genome sequenced. Whereas in COVID, in 2 weeks, it was genome sequenced. And after sequence, you can develop an ART to test it. And with that, you have labs that can do PCR tests, PCR tests. With the genome sequencing of COVID-19 virus, we could develop a PCR test for it. Yeah, and that's done through the labs. So we suddenly realized this lab has become a national resource. Yeah, it's a very important platform. So we decided to nationalize it as CDA, give it a huge, bigger national role. Yeah, but CDA is one aspect. In fact, as we speak, this process is a bit unprecedented. You know, seldom happen where we actually nationalize an outfit in a hospital into government proper as a statutory board. So the staff need to be transferred, their benefits needs to be transferred to a new entity. We in fact just had a good discussion with the unions, came out with a package. Yesterday, they presented to the staff, and gradually they are all converting over into the CDA. It's actually a lot of work behind the scenes to resettle staff into a new environment. CDA is one aspect. The other major aspect that I think is quite unique in the Singapore context is our amendment to the Infectious Diseases Act. We are probably one of the few jurisdictions, maybe the only one in the world, where we actually articulated different powers for MOH under different circumstances. Yeah, we have 4 levels of alert, from peacetime all the way to emergency. And then in between, there's outbreak and there's a threat, I think, all 4 levels. At each level, we trigger different powers for the minister to manage the pandemic. So this is a big lesson we learned from COVID-19, that we cannot look at every pandemic and think it's SARS, which was what we did after 2003. We start thinking, is this like SARS? Then COVID came and it's totally different from SARS. Less severe, but still quite severe, but less severe than SARS, but very much more contagious with an R that hit 5, 8, and so on. And you need a totally different set of ammunition to fight this virus, right? And so we provided those powers under the new IDA and gave us a lot more flexibility. So the lesson for us, next pandemic when it comes, I bet you we'll all think it's COVID, but it will be different.
But now you're probably much more equipped and prepared because you have a much more fit for purpose setup.
Yes, I think that's the key word, fit for purpose. And before fit for purpose is to recognize the enemy. I think that is the key lesson I learned. That when you see something new, understand it. Similar to the questions we asked at MOE, our first instinct was correct. Understand it. Does it affect children more or less? That's one of the first questions because it decides on schools. Next, you have to learn about the severity rate, how severe it is. Third, you have to learn about the reproduction rate. And fourth, you have to learn about how does it transmit. Is it by air, by touch? Is it transmitted when someone is asymptomatic or when the person is symptomatic? All this matters. Once you understand these few simple characteristics, then you know what is the policy response.
Because we live in such a disruptive time, most countries or the world is kind of undergoing this great fragmentation, as someone like Giorgio will put it, where everyone is trying to break away and then form their own block. So there is a very huge inclination to not integrate with the rest of the world. But in Singapore, there's actually a huge project that's happening now that we're trying to integrate better with Johor. And that's actually not the norm now in the world, that people are not, or countries are trying to integrate better with other economies. And you're also the MP of Sembawang, so you're literally at the tip, or you are going to be at the tip of the integration once Woodlands and Johor gets linked up through RTS. I wanted to ask you, from your perspective as an MP of Sembawang, what does this integration of this through the Johor-Singapore Economic Zone, what's the promise for you?
Well, actually, there's a close relation. I would say one of the most painful things that happened during the pandemic was that the causeway was closed. In fact, the causeways were closed. The 2 links were closed. And you sever ties between Johor Bahru, Johor State, and Singapore. It was so painful for so many people, Malaysians and Singaporeans. And so at that time, I also worked with my counterpart, Khairi, at that time. We did whatever we can, work with our trade and industries colleagues to reopen the causeway as soon as we can. And I'm glad it opened. But it just showed that when you lost something at that time, then you realize how close you are. So now I'm Sembawang. We share a border. My constituency, my GRC, shares a border with Johor Bahru. We're going to have an RTS next year, end of next year. If everything goes smoothly, it will open 10,000 passengers per hour each way. So there's a lot of exchanges. 100,000, 200,000 exchanges a day. Right? I think it changes the landscape totally. As I tell my residents, and sometimes they tell me, But then going to Johor is easier than going to Orchard Road,
Yeah.
As it is going by the causeway, they felt that immigration is not that big a hassle, right? I went to Johor twice in December. Once I went by normal channel, and it was very convenient. You pass your passport to the immigration officer. A minute later, they pass you back, which is a similar experience I had when I traveled from Shenzhen, from Hong Kong to Shenzhen. And I think people are feeling that kind of ease and convenience. And with RTS, it's going to be even easier.
Yeah.
And so you start to feel that actually the economies are so intertwined. Another trip I went, also in December, I wanted to take a look around Bukit Jaga, right? Because the two stations, the Singapore side station is Woodlands North, which is the RTS station. On our side is Sembawang GRC. On the other side is near the checkpoint, Bukit Jaga, also near City Square. So when I go over, walk around City Square, was hanging around the atrium, and I hear people say, Minister Ong, can I take a photo with you? So I turn around, it's my resident. So I took a photo, and then another voice said, Minister Ong, can I take a photo with you? And I turn around, I don't know that person. I say, where do you live? They say, it's Jurong. But they came over to JB. And then soon you have a crowd of people, no? You get that sometimes as a minister attending an event here, but I don't expect that in Johor. After a while, taking photo, I asked, where are you from? Some Malaysians are asking to take photo. They say, I know you, I saw you on TV. It was like, well, is this even legal? Am I doing anything illegal? It shows the closeness of the two peoples. So I think there's great opportunity. But at the same time, I would say three things that will affect us once RTS is open. Number one is investment. And I think future investments will look into not just Singapore, but also leverage on Johor. How do I configure my division of labor so that I benefit on the strengths of both sides? Number two is flow of people. I would expect many Malaysian work permit holders, they may stay in Johor and commute over to work. And making it a lot easier. Thirdly is consumption. That is where we need to be quite careful because a lot of consumption is going to go over. Retailers, coffee shops, I think will feel the pressure, which is why I'm also working with MTI to see how can we help this group, especially those in the north. They need to be able to survive. Costs, we need to find a way to help them moderate. How to also rejuvenate their business. How to encourage some of them to open outlets on the other side, benefiting from the market the other side. I think these are some of the practical things we are looking into.
Economic integration will look a lot more like what you shared earlier about Hong Kong and Shenzhen, the Yangtze River Delta. You can kind of balance the synergies more in terms of FDI coming in.
I think different. No? I don't want it to become Hong Kong Shenzhen.
But there are similarities.
Some in the sense that it's two territories that is very closely connected. In the case of Hong Kong, they wind down their manufacturing many years ago and they moved to Shenzhen. And then over time, Shenzhen also have a big renaissance in startups, in R&D, digital, creative sectors, even AI. And then plus the consumption in Hong Kong move over to Shenzhen. So actually it is a situation that's quite challenging for Hong Kong, I find. It is not the situation we want to be in. We have always kept engineering. We have always kept manufacturing. We are still a hub for tourism, for R&D, and we should keep that. But now I think with Johor integrated with our economy, more closely integrated with our economy, I think we have to see how to make ourselves even better. The other example we look at will be, say, New York, New Jersey, but neither do I think that describes things accurately because action is all in New York. New Jersey is just a suburb where people go to live and to spend. Not even spend. I think they still spend in New York. I don't think Johor is that. Johor is actually very vibrant with a lot of offerings. So I think you look around the world, I can't find an exact situation that we want to emulate. But this is something quite unique that we have to make the best use of.
From my perspective is that, we definitely want to keep an industrial base here because we are starting to see the huge cost of deindustrializing an economy when they don't have that kind of industrial base or engineering capability. And your economy atrophies very quickly. the question I had then would be, if you were to look at the ideal state for the economy as an MP, right? What would that look like for Singapore after this integration?
My involvement in RTS and in Johor is because of Sembawang GRC.
Yeah.
So it's in my capacity as an MP.
Yeah.
There is some interest in healthcare because Singaporeans do go over for their for their treatments, including outpatient scans, for example, dental treatments, for example. Yeah. So these are policy issues that we need to look at some point about Singaporeans going to Johor to seek medical treatment. But by and large, my involvement is one of an MP. Yeah. And I think there is a lot of opportunities we can work on. I know that my residents are looking forward very much to the opening of RTS and stretching their dollar there. I always tell them, I go over to eat char kway teow. It's 8 ringgit, 12 ringgit, If not of the exchange rate, if the exchange rate is still 1-to-1, which is the case when I grew up, it's actually very expensive plate of char kway teow, We only find it affordable because of the favorable exchange rate in our favor. So Singapore economy must always do well. And the dollar is strong. We can stretch our dollar when we go overseas. Consumption is one big aspect that is very relevant to my residents in Sembawang. But also, I think in terms of the ease of workers from Johor, those with work permit coming over to work, that is also very positive for many of our employers. We need to cushion the downside for retail, for F&B in the north, and working with MTI on that. But all in all, I think it's a very positive development, especially for us in the north. So my counterpart on the other side, around Bukit Jaga, I have two counterparts because there's the state MP and there's the federal MP. State MP is Andrew Chen. Federal MP is Liu Jin-tiong. He's a vice minister. So I'm in touch with both of them. So when the RTS open, I think we should look at how we can host each other's residents more frequently. It is very odd. I think first time in Singapore we have this kind of situation where I find that I'm so close to another constituency that is in another country. Closer than say East Coast or West Coast or Tanjong Pagar even. But I think this is how the people traffic will flow in future. Andrew Chen tell me an interesting story, which is during COVID. We talk about how COVID severed ties and it was so painful. So he was saying he cut his teeth as an MP because during COVID, so many Malaysians were working in Singapore and they continue to want to work in Singapore, but because the causeway is closed, they can't go back. Some of them are mothers, and so their babies are back in Johor, and they were breastfeeding the babies, but they're stuck in Singapore. So he found a fruit seller in Sembawang. Being a fruit seller, he knows how to maintain a cold chain. So the mothers express their milk, send to the fruit seller, who then refrigerate properly, tag every mother to every baby, and then truck it over. And deliver to the babies. In 2 years, over the 2 years of the pandemic, delivered 65,000 kilograms of breast milk.
Wow.
It's an amazing story,
Literally a ground up cold chain.
Ground up cold chain through a fruit seller in Sembawang. I should go and pay the fruit seller a visit.
I wanted to ask you about you cutting your teeth because on one hand, it's very promising to see Singapore go in that direction of bucking the trend of trying to see new ways we can configure our economy and stay relevant and competitive. So as a young Singaporean, that's actually really encouraging that we're thinking about these things. There is also another important aspect is that you always need leaders at the top to be thinking about this. And you need talent, and talent is rare. And what I wanted to ask you was that you've had various positions in government, outside of government, private, public sector, even in the trade unions. What is it about being a minister or being a political office holder? What are the skill sets you need that maybe people outside, they don't have a clear sense of what that entails?
Well, I worked several years in the private sector as well. And we have many private sector leaders working in public service almost voluntarily chairing our boards, sitting in our boards. So I interact with them a lot. And I find many of the skill sets are similar. You need to be able to digest data, digest facts, crystallize the issue down to a few considerations, make a judgment. I think that's the key thing for leaders to do. And also, of course, have a vision about the future where we are leading the organization or the sector. Those are the key skill sets for a leader, I feel. And also communication. So I get the list gets more and more. But vision, decision making, able to communicate, and able to draw in people to work for you. Yeah, I think these are the key skill sets, similar whether in public or private sector or the unions. I think what is different about public sector is probably peculiar to the public sector, that there's a certain way of working in the bureaucracy. So the difference is more instinctive than skills. The difference is in instincts rather than skills. So a private sector person coming over may have all the skills, no, but may not have the same instinct or patience or inclination to work in the bureaucracy. Yeah, bureaucracy needs maybe a bit more patience and the ability to know how things work, how to navigate your way in order to arrive at the right decision.
I've heard it said that, a lot of people say, it's easy to plant, or plop a private sector executive into politics and they can do well.
Some do. Like my friend Tan Si Ling, I thought he's doing very well. He's coming in with a private sector zest, full of ideas. He sometimes raises ideas with me informally. Okay, how about we do this? Sometimes I tell him, no, in the bureaucracy, it doesn't work. It doesn't work like that.
Yeah.
Other times, I think it was very good ideas. So I think he's doing well and adapting very well to the system, right? But I think it requires you to bring that zest and the enterprising spirit from private sector and able to apply it in the context of public sector, which functions differently.
Do you think about talent attraction a lot? How do you spot, or how do you kind of attract talent to join your cause?
I think the key thing is getting harder and harder to attract private sector talent to come over to work in public sector. Yeah, whether as a public servant or as a politician. I think the most powerful and persuasive factor for them to consider is the mission. Yeah, it's the impact you can bring to so many people that you can't achieve. You rarely can achieve that in the private sector. In public sector, you can do a lot of things that impact a lot of lives. And so that, I feel, is probably the most attractive attribute of a public service career.
But what are the deterrents, you think, from people to kind of join you in politics or in policy making? Is it because scrutiny, or is it because of like different opportunity costs? Because I think back in, like, for example, Lee Kuan Yew's time, he would say it's not replicable because everyone knew back then it was like you either sink or swim. But now the considerations are different.
I'm a bit idealistic. So everything you raise, I think, is a factor. Scrutiny, privacy, some is pay.
Yeah.
But I think ultimately, the biggest deterrent is when they fail to see that sense of mission. When they say, okay, I come over, I may end up dealing with a lot of paperwork, red tape, I don't see why I must go. Why I would consider switching my career. So I think the biggest deterrent is the failure to enable them to see the possibility of making a huge impact to current and future generations of Singapore. Yeah. If that can come across in a compelling way, and it's not easy, but we have to make it compelling, then I think more people will want to join and prepare to make all these sacrifices. And the rest becomes just reasons.
And for you, I guess it's about painting that vision of the future. So then naturally, I have to put you in the spot, right? If you were to kind of make a pitch for someone to join you, what is the kind of vision that you're painting for them to help serve Singapore in that sense?
The kind of issues we deal with in every ministry, I think you will always be there. COE prices, congestion, cost of living, will all be there. But I think what may be more exciting is what has changed What are the generational changes, and how people can play a part. And I think we have a few generation changes we are grappling with. These generational leaders we have to grapple with. Number one is geopolitical, right? You have a different geopolitical situation, which means Singapore's role is different. Yeah, we have to redefine that. So the key thing is the most important bilateral relationship in the world is US and China. It has changed. So when it has changed, doesn't mean end of the world. There are new opportunities. Situation have changed. How does Singapore continue to play a role? Being partners to both, being friends with both, and adding value to both and the rest of the world. Yeah, requires us to rethink. Yeah, so that's number one. That's a generation change. Second is the biggest social development that we are confronting, which is aging. This is inexorable. To me, the only way to tackle aging is to stay healthy. Yeah, stay healthy, stay active. Then 65 is not old. Maybe 75 is old. Then I think that's the only way. Push back the definition of aging, not just on paper, but in real life, medically, economically. That is what we need to bring about, which is what Healthier SG, Age Well SG, every policy we are doing is moving towards that direction. Thirdly, I would say climate change. We may not feel it. Climate change is a bit like chronic illness. It worsens year by year, but one day you drop off the cliff. Yeah, and that date is getting nearer and nearer. Ice caps melting means water level rising, which is an imminent threat for Singapore. So we need to tackle that. Internationally playing a role and being a role model, being a reference point that other countries can see this is a best practice. Domestically, also protecting ourselves against rising water. Finally, I would say politics. I think our democracy is maturing. Singaporeans have different aspirations. There's an underlying desire for more opposition, more diverse voices. So I think politically we are probably not at the equilibrium, Sometimes people talk about opposition wipeout. It's impossible. Singaporeans want opposition. It's not possible when you want opposition for opposition wipeout. There will be opposition. But the question is, how many, what role do they play? What are the standards we set for ourselves, for opposition, so that politics continue to work for us? Yeah, we must arrive at a stage, whatever the configuration that let people feel that is an equilibrium, it must be a good equilibrium, a positive equilibrium, not a negative equilibrium. A positive equilibrium where Singapore is still decisive, small. We can't change that geographical fact, but at least decisive, agile, adaptable. There are big countries where they are in political gridlock, but they can survive it. We're a small country. If we are small and yet in political gridlock, then we're in big trouble, right? So we must always be small, but compensate. We will be small, but compensate that with the decisiveness, agility, and ability to look long-term, which was the start of your question. Then I think we are in a good place. Yeah. So I think that is also a generation change. How do we transit to a healthy, positive equilibrium politically?
With that, I come to my last question.
Okay, after I say all this, I don't know whether we will be able to attract private sector talent to come
I think all the more the appeal will be there. The first generation of leaders did that by framing the existential challenge, and I think to a certain extent we also live in times where we need to reconsider the existential challenge that Singapore faces as well.
Yeah, never underestimate the future.
The last question I had was, what is the one piece of advice you would give to a fresh graduate, Singaporean or not, entering the workforce today?
Oh, don't feel sorry for yourself. Yeah, every generation have their own opportunities and own challenges, but because it's different, there's always every generation. Like when I came out to the workforce, I was like, how come my last generation seem to have it better? I seem to have it worse. Not true, lah. When I think back, actually, we had it quite good. It's likewise for this generation. Competition is tougher, but opportunities are abound. The more opportunities to work overseas as well. Yeah, so take it as it is. Yeah, there are pros and cons with every generation. Yeah, so be positive. Employers look for that. Yeah, always be positive. Always be optimistic. Always know what is my value. What value can I bring to the employers? And try. Don't ask for work from home. Let the employer offer you. Don't be the first question to ask. It doesn't leave a good impression to the employer.
That's good advice. With that, thank you, Minister, for coming on.
Okay, thank you.
Listening to today's episode. If you are watching this on YouTube, please consider subscribing and turning on notifications for whenever new episodes are out. If you're on Spotify or Apple, it would help us greatly if you could leave a 5-star review on those platforms. Once again, thank you for tuning in to the Front Row Podcast.